so I'm really excited about the panel discussions that we've had this morning. There's so much incredible work that's going on and so much good news to talk about amidst some of the challenging news that we'll talk about. But thank you so much. I'm humbled to be able to be with you all here today, and we'll turn over to my colleague and co-host.
Yes, Boston is not the center of the universe. Good morning, everybody. We're super excited to be here. Robyn and I are one of 11 women senators out of the 40 senators that represent the Commonwealth of Massachusetts. And we're one of 242 women to ever serve in a body that's had over 20,000 men. And when you think about progressive legislators or women of color, those numbers wouldn't go down. And so for us, it was really important to tag team and support MAWOCC because there are women and women of color in all of the 351 cities and towns in Massachusetts, right? It's not just Boston, although my friend over here who went to high school together and think Roxbury is super important. It was fascinating as I got into office to see women coming from Worcester, from Springfield, from Pittsfield, from Taunton, from Hyannis, and being like, we're here too, and we're doing good things, and we should just put our hands together to make the Commonwealth a better place for all women. And so we give it up for MAWOCC, because if we didn't exist, we wouldn't, as legislators, really understand the depth of what is happening across our entire Commonwealth. So just happy to be here and looking forward to the rest of the day.
I just want to point out, since we're growing up, we both graduated from John J. O'Brien School of Math and Science, and I was Liz's first unpaid campaign staffer. She ran for vice president of our senior class, and she was out sick and asked me to write and read her speech. So I was kind of an unpaid speechwriter, too. So thank you both for being here. Thank you for co-hosting this event. I also want to just take a moment to shout out the board members of MAWOCC. If you're in the room, just please stand up and we'll give them a round of applause. I always think it's important to remind people that as much as these events are great, there are people that do the really hard work behind the scenes, the planning, the executing, the phone calls, the emails, and MAWOCC does a really good job of doing this, so thank you. So we are now pleased to welcome our first panel on maternal health in women and children. Please join me in welcoming our panelist and moderator, Rivera-Cotto, Esquire, General Counsel and Vice President of Central Region and member of the MAWOCC Board of Directors, who will be moderating this morning. Moody, nurse, childbirth educator, lactation coach, and birth center developer. Dr. Crista Agbakwu, professor of obstetrics and gynecology at UMass Memorial Health, medicine at UMass THN Medical School, and executive director of collaborative and health equity. That is not. We are waiting for one of our other panelists, and she will join us as soon as she is able to. And that is Representative Brandy Fluker-Reid, representing Boston's 12th Suffolk District. Let's give it up for our panel. Is this working? Yep. Good morning, everybody. Good morning. I'm going to start with you, Senator Miranda. Can you talk about the maternal health bill that was passed into law last year in August, and tell us about its legislative intent and the expected impact?
Okay, good morning again. I'm first, right? Thank you so much. So I want to take you down a little bit memory lane before I talk about the bills. I think it's important to understand how things become law, and there's a long process before something actually gets to that building, and then gets through that building and makes its way from a piece of legislation that is filed, and then it is signed into law. And in 2017, I probably had the worst year of my life, and a lot of people knew that in August of that year, I lost my youngest brother to homicide, and it was really the catalyst of losing Michael was what made me brave enough to run for office. Now, I probably was well qualified, like many of you, to run for office, but did not see that in my life path. I didn't see senators and representatives that looked like me, that had similar life experiences, and losing Michael made me want to know why in the state of Massachusetts, where we had tough gun laws, where we had the lowest number of gun deaths, where we have so many resources, best hospitals, why was my little brother at a Boston nightclub and he didn't come home to his teacher? And after months of being in grief, I went to the State House, I ran for office, I beat 4 men, and I was like, wait a minute, I didn't even know how to run for office, and then I became a state rep. In the first week I get in the State House, some of you heard the story, but March of Dimes gave a presentation to all women legislators. And I sat in the room, and there was only 2 women of color. It was me and Elle, and we looked around, and the data basically said that the 10 worst zip codes to give birth were 6 out of the 10 were all in the city of Boston. It was Hyde Park, it was Mattapan, it was Roxbury. And I was like, wait a minute, like, you just basically told me I'm going to die giving birth. That's how bad the data was. And the other areas were Bristol County, Holyoke, and some other towns. And I walked out of that elevator and realized when I took the elevator down that I had something else that had happened in 2017 that I had basically blocked out of my mind. And what I had blocked out of my mind was that my sister had given birth to her daughter Mila in May of that year, and I was there for the birth, but my sister didn't survive. And the night before, my sister was asked to take Tylenol and go to bed because it was her first child, and the doctor said that she was anxious, right? And my sister knew innately that she was not well, but did not feel brave enough to talk back to her doctor and advocate for herself. So fast forward from 2017, I get in the State House in 2018, I hear this report. Representative Kay Khan and Senators Roush had a bill that was on maternal inequities. But they couldn't pass that bill, and I think probably so there were 2 white women representing 2 wealthy districts, and I don't think it really resonated to the other colleagues that there was a problem, Senator, a problem in the Commonwealth of Massachusetts with maternal health, because go figure, like it's Massachusetts. And so I joined their team, we pushed the bill, and it was unanimously voted in both chambers to do this commission to study what was going on with maternal health. In that commission came out 137 recommendations, and we worked each recommendation as much as we could. And it was
age has any of it been implemented, and what has that been?
So the bill was passed into law in the winter, and so if you don't know anything about the state government, it's 2 years, and normally the first year of the term you're filing bills and budgets, and then you spend the rest of your term kind of working it. And so the Department of Public Health, Health and Human Services is working with the legislature to get through the pieces. One of the major pieces is to certify and ensure that midwives can practice in the Commonwealth, because midwives do save lives. Birth centers do save lives, and we only have one birth center in the Commonwealth of Massachusetts. And there's an area that me and the governor don't agree on, and I think it's because it's not a good point to share. We do have maternity deserts in the Commonwealth. If you can't get to a hospital in 20, 30 minutes to give birth, you're living in a maternity desert. For most people, rural communities, central Massachusetts, even in the city of Boston, outside 20, 30 minutes, if you have a maternity ward like in Rockland, it's closed, and you're pregnant, and you have to go to Weymouth or come into Boston, and you have an acute emergency, you're in trouble. And so the pieces that we're working on now is making sure that midwifery care can stand up, and we can make sure that people that choose to go to midwife and give birth in a birth center can. The most exciting thing was that Mass Health was able to include doulas in their waiver last year. So thousands of people have actually sought after a doula, and we have 200 more registered doulas in the Commonwealth, and that is helping women and birthing people all across the
Commonwealth. You're a lactation coach, a child educator, and a birth center developer. Can you share your thoughts on how the maternal health bill has been implemented from your perspective as a nurse working in the Worcester community? What's worked well and what has been the challenges?
Thank you. Excuse me. Just a quick shout out for those people that, like you're saying, it took a lot of work to get this legislation passed, and I'm really grateful for everyone's part in that, because it certainly helped change my life and allowed me to help to change other people's lives in the Commonwealth, specifically in Central Mass and Worcester. So I work for Worcester Community Midwifery. We have a small midwifery practice that we've been doing homework for a few years, and that's been wonderful, but with the legislation that's passed, it's allowed us to have the ability to open Worcester's first freestanding birth center. And actually this week, really proud to say that the Worcester Planning Committee passed our special permit, so we can continue moving towards the construction of this location on Shrewsbury Street in Worcester. So specifically in how I feel that we've been impacted, there is such a need for midwifery care and for our birth center, and it's proven fact. We see a lot of people that now with the more awareness that this is happening are really searching for the customized, the person-centered care that midwifery offers. It's been proven that midwifery care can save lives, like we said, midwives save lives, with having better outcomes and with having the ability to really get to know our patients on a more personal level. So in Massachusetts, the incidence of severe maternal morbidity, which is things like complications with cardiovascular health, things like these long-term impacts of kidney failure that can happen to people after they have babies, especially for women of color. We actually rank 45 in the 50 states. So, yeah, Massachusetts. So having the ability to provide more customized care where we really get to know our families and get to know our birthing persons is going to help to mitigate things like severe maternal morbidity. So I'm really elated to be able to work with my friend Rachel Blessington, who's over here in the corner, and Alex, and help to bring this level of care to Central Mass. It's really going to drastically change the landscape of maternal care and really help save lives simply by existing and allowing people to have a different option for care. Having the different option of care is really beneficial with having the mass health reimbursement. Insurance reimbursement is a huge barrier, and really just financial ability to have midwifery care. With having mass health being accepted at birth centers, it's making it able for anybody to be able to access this level of care, not just people who can afford it out of pocket. So that means, people who previously felt that midwifery care was out of reach. Like, I know me for myself, I have 3 children, and I never knew that this was possible. I went to my appointments, did what I was supposed to do, and was like a good patient. Like so many people, that's what we do. And probably like your sister, we don't think that you have a voice to speak up. And now learning that, like, it could have been possible for me to have a midwife, or for our future generations and our friends and family to have access to this life-saving care at a birth center in Central Mass is just enormous.
Just brief follow-up with regards to congratulations on the licensing for the research center. I wish you were a really good company. Who's wondering about
Speak up.
can you hear me? Sorry, thank you. I'm wondering about sort of the impact county-wide for those, that are part of Worcester County but not in Worcester County. Are there any plans in the future for opening a center in Worcester County but not in Worcester?
Well, the need for birth centers, even in Worcester alone, this will be one. There could be 7 in Worcester, and it still wouldn't be enough. So I imagine that as with the legislation and the ability to create more space for midwives to practice full scope, more people will be able to open more birth centers. One of our objectives with being the first freestanding is to help kind of create a blueprint. With the legislation, some of the changes also included different regulations for birth centers, and the regulations make it more sustainable and accessible for midwives to open a center. So definitely the future plans to open more will, I'm sure will happen. I think just getting the first one started it's been a lot of work. It's been incredible. I've learned so much. But hopefully with creating this first freestanding birth center, that will also really take the place of a community center, not just serving for birth, but also for a whole growing family, like things like mental health issues, pelvic floor. We'll have a pediatrician, new nurse practitioner rather. So having the ability to create the first, more community center to create care for a whole family will hopefully help other people to see that this is possible, and other groups of midwives and practices will be able to continue in the same steps, and we can help hold each other up and build these birth centers together.
Thank you. Dr. Crista. Dr. Johnson-Agbakwu, sorry, but I know it's Dr. Crista. So as a practicing physician in the health equity space, can you share your feedback on the implementation of the maternal health bill, particularly around the high-risk pregnancies? And you also talk about the dual training program and the small business technologies partnership with MAWOCC.
Excellent. So I am so very honored to be here among my esteemed colleagues really working in the space to advance maternal health. And I'm an OB/GYN physician. I've been practicing for 25 years. I'm new to Worcester for the past 2 years. I can imagine more. I'm really excited about the work that we're doing in Central Massachusetts. Shortly after the bill was passed, creating the doula benefit through Mass Health, at UMass Memorial, we were able to launch a doula program led by Dr. Sharice Hamlin, who's the medical director, and Chantal Collins, who's here in the audience. They have done remarkably well in a very short span of time, literally only 18 months, where they have truly built from the ground up a robust program to really meet the community where they are in terms of how do we close some of those gaps, which at the root is representation, trust, creating safe spaces that are where birthing mothers are seen and heard, where we honor and uplift their humanity. We have shared cultural values, of resilience, of vibrancy, of linguistic concordance, to really make sure that we are bonding with our patients and our families and communities in ways that haven't been done before. through a partnership that's providing technical assistance. So these doulas, they're training an entire workforce of doulas that reflect the communities that we serve, who can now build an entire business model. This is an economic empowerment initiative that's not only creating opportunities for women to serve in this way, but create an entire business enterprise that can be self-sustaining and really grow and truly be a model for the rest of the Commonwealth and the nation. But I also want to talk about the elephant in the room here. You know, while it's absolutely crucial for us to be advancing legislation and policy and increasing access and widening opportunities for midwifery services and birth centers, we also must face the elephant in the room, and that is structural systemic racism, which is at the root cause of why we are wrong. And I have to call out the important work that we are leading, because representation is everything. When you look at Black mothers, and just Black people in the United States, we represent 13% of this country, the population. Even in Worcester, we reflect the nation, 13% of our community is Black. However, among healthcare medical professionals, then actually we're only 5%. When you look at Black female physicians, we're only 2.8%. And look at someone like myself, who is a full professor of OB/GYN at an academic medical center. I represent 0.8 of all U.S. physicians in this entire country. When I joined UMass Chan and UMass Memorial 2 years ago, I represented 2% of all the faculty. 2%. There were 0 Black OB/GYNs in our department. Within 2 years, we now have 3. That requires intentionality. When I say the house is on fire, we need to address the structural systems that are baked into the air that we breathe. The walls, the fabric, the policies and system and structures that do not see the necessity of representation, both inside and outside of our health systems. It is absolutely crucial. We know the data that you can reduce infant mortality by 50% when care is matched by a provider who shares cultural and racial congruence with that patient. We see that in every marker: cardiovascular health, primary care. Studies have been published and continue to be published, demonstrating that even in an entire community, if there are more physicians of color working in a community, in a zip code, the life expectancy of that entire community raises because of that diverse representation. It absolutely matters. And so while we do this work, while we're pushing legislation, we're pushing increased access, we're pushing postpartum care, we're pushing midwifery care, we also need to recognize simultaneously, we need to be addressing the fact that we need to diversify our workforce. We need to compel that there's anti-racism training among our hospital staff at every level. And it's not just one and done. It must be iterative. There must be a metrics of accountability built in to ensure that patients are seen, are heard, are listened to, receive respectful care, free of bias, that's inclusive, respectful of their language preferences, and that we can ensure and nurture and cultivate trust. And that's at every level, from the person who greets you at registration when you walk in the door, to the nurse, to the medical student, to the resident in training, to the faculty attending, to the community provider, the nurse midwife. Every aspect of that care team must be respectful, must recognize and honor our collective humanity. And that's what has been missing and continues to be missing. That's the weathering that we all bear of living from the moment we have breath in this country, the stress of lifelong exposure to racism, bias, What we see right now in the federal government, putting a cap on student loans for professional degrees. So basically, what has been put into law is that you cannot take out more than $200,000 over your lifetime in pursuing professional education. That means a cap of $50,000 every year for a student trying to become a doctor. We know the cost of medical education far exceeds that. And we as communities of color bear the disproportionate burden of not having deep pockets or generational wealth to support our educational pursuits. That's closing the doors of future doctors and nurses who would otherwise pursue careers in health. So we better reflect our patients. But yet there are so many policies becoming law that are squelching our ability to pursue our dreams. So I just want to say that while we are advancing important legislation that is absolutely critical and crucial for increasing access, increasing capacity, increasing the workforce, we must also tackle the elephant in the room, which is racism, which is at the root, at the foundation to why we have persistent health inequities and the worsening maternal crisis in this country. And until we tackle that, it's going to be so much harder to achieve the gains that we want to achieve.
Representative Brandy Fluker-Reid is joining us. Thank you. Can you talk about the Massachusetts Moms Matter Act, also known as MOMS Act, which was an expansion of the maternal health bill passed last year? What is the MOMS Act, and what is its intent as well as the expected impact?
Good morning, everyone. Apologies for my tardiness. I'm going to answer your question, but I have a really heavy heart. And for those who know me, I'm a woman of faith, and as I was praying, I had a crisis at home and trying to figure that out and trying to get hold of Sid and texting and I'm coming, I'm sorry. And I was like, dang, I'm tired. And not in like I didn't even know I was asleep last night. But I thought about this room and who this conference was for, and my sister doctor, whose name forgive me, I do not know yet. Kind of just spoke to what was on my heart. So I'm going to talk about the Moms Matter Act, but I just want to acknowledge for women and women of color, particularly Black women, I know you're tired. And I'm not talking about physical tired. I'm talking about the weariness of this world, of this administration, of the labor that we carry day in and day out to stabilize organizations, systems, communities that do not stabilize us. And I feel that in my spirit for the last couple of weeks, and that's also an element in the room that we must acknowledge. So as I talk about the Moms Matter Act, I have a little talking points, but my phone is off now, so it's from my heart. It talks about the systemic racism. So we as Black women, Dr. Christine mentioned the weathering effect. If you're not familiar, we go through so much struggle as a community that things that would take other people out don't take us out because we have sustained it for days, for years, for months, for generations. It shows up in our bodies when we go through the process of birth, which I have yet to have the privilege of doing, though it is my prayer request, so y'all keep me in prayer. One day, and the reason why the Moms Matter Act is so important is because Black women are least likely to seek mental health care and support regularly on any given day. Not to mention when they're going through the process of birth and all the hormonal changes that are occurring in their bodies as a result. So we're the least likely to access mental health care, period, and not to mention when we're going through this process. Then we are experiencing the systemic racism, not just in all of the institutional ways that the doctor mentioned, but also when we go into work with our colleagues and our very well-meaning liberal white partners who show up in ways that also cause harm, that we must also internalize and process and move forward while we're still fighting the fight, looking as fabulous as we do. That's right. okay, no, okay, I'm waving the red flag, I need help. Where do I go? As a Black woman, as a woman of color, where can I find the support that's necessary? What research suggests is that circles and care groups are really actually effective in folks who are experiencing perinatal mood associated disorders, that's PMAD, postpartum depression, perinatal, all of that. The problem is here in the Commonwealth that there aren't enough of those groups that exist and not enough that are led by women of color. I represent the 12th Suffolk District. It's the blackest state rep district in the Commonwealth. It's most of Mattapan, parts of Dorchester, Hyde Park, and some in town of Milton, 2 streets in Rosendale. I tell the story often of a constituent who lives right on the Hyde Park Mattapan line, identifies as a Black woman, recognized that she needed the support. Like she's like, okay, no, wait, something's not right here. I need to get some support. The closest group to our geographic region was in Walpole. If you don't know Massachusetts, just think from Mattapan, Hyde Park line to Walpole. It was in the middle of the day at 2:30 p.m. twice a week. Thankfully, she had a car and transportation. Thankfully, she had the flexibility in her schedule and the means to attend. And when she got there, she was the only melanated person in the room. So I guess I'm painting this picture of what we already carry, and we're going through this beautiful process that can cause strain, in addition to the external, institutional, and interpersonal racism that we face. Then we try to get access to care. It is far away and unattainable, and the care does not look like us. And that's what the Moms Matter Act is trying to fix. We're trying to make sure that we provide grants to professionals who want to support those who are in the birthing process with the perinatal mood associated disorders, and that we have enough of them that they are close to home. So no one has to be burdened about transportation or work schedules to get access to care that they need. And that's all I'll say for now.
Wonderful. Well, I so briefly, just as a follow-up, and maybe we'll start with you, Representative, because along the point of, and I want each of you to address it. We've talked about the intended limitation of the maternal health law, and now the nonsense as you described it. What, if any, additional advocacy or changes in laws to address these disparities and these issues should be implemented, or organizations like MAWOCC, what should we be doing going forward? Because this is an uncommon thing, right? I mean, we know that more work needs to be done, but we also need to be educated about what that is. And, laws don't always cover every single, issue or problem that is being faced. So what more needs to be done, and what advocacy needs to be done?
That's a good start us off. We need better data. So right now, and I'm really excited about some of the work that's happening in Central Massachusetts right now. But when you look at maternal and infant morbidity and mortality data, it's 2 years behind. Just a couple weeks ago, I was on a call with Dr. Maggie Castillo, who just retired as Commissioner of Health for our city, Crista. And she has, one of the last things she did before she retired was create a data dashboard. It's called the Worcester Integrated Health Data Exchange. It is revolutionary. It is meant to create a data dashboard on maternal and infant health indices so that we can move the dial forward in terms of making decisions that influence policy and influence practice in real time and not waiting on data that's 2 years old. And so we're creating a data dashboard working with UMass General Medical School to use the latest technologies in health informatics, AI, machine learning. We know that there are biases that can be baked into the data, and that's something that we're at the front line of how do we address to make sure that we can truly understand the factors that are influencing some of the outcomes that we see, so we can best tailor interventions in ways that are patient-centered, community prioritized. And so we're going to be focusing on 3 major areas where we know hypertension, high blood pressure in pregnancy, and preeclampsia, which is a more severe form of elevated blood pressure that leads to seizures of function. Those are the 3 health priorities that are going to be the focus of this data dashboard that's coming out. And what I like is that they're going to be building in social vulnerability. So it's not just looking at data coming out of our health system, like C-section rates and blood loss. We're going to be matching it with social vulnerability. Where does one live? Residential data, zip code data, data on housing insecurity, food insecurity, data beyond just race and ethnicity, but language. You know, Worcester in Central Massachusetts is a gateway for migrants from all over the world, with major language and communication barriers, which are another factor impacting access to care and healthcare services. And so hopefully this data dashboard, when we bring in some of these innovative tools, can allow us to get data in real time to be able to make actionable decisions that can inform policy, that we can then use to send as briefers to our elected officials, so they can use this data to advocate for the changes that we need to see to better improve care for our communities. Thank you.
She's been dropping the mic all morning, and I was like, I need another cup of coffee. So I can think of 3 really recommendations I'm thinking about going forward that have been top of mind for me in the last 10 months. One is that although we started this work with the majority of people who had lived experience or expertise or the cultural and linguistic congruence, as you put it, that does not mean that the Department of Health and Human Services or the Department of Public Health or the Department of Mental Health or Mass Health and other insurers actually have those same type of bodies. They do not. And so it's incredibly important that step 1 is to keep the people closest, like Congresswoman Ayanna Presley says, to the pain and purpose aligned with what the work is moving, because it would be nothing, right, if we pass this bill and then we put it in other people's hands and then they, for better purposes of words, they mess it up. And so that's an important piece of the implementation that I'm paying attention to. Secondly, although Massachusetts was, a year ago, like the most comprehensive bill, there are other states that are going to do the things that we did not do. For example, while we were in the process of doing the bill, large sections about incarcerated women and other women were not included, and so we weren't able to do that to pass the bill. And so Pennsylvania, for example, created a Black Maternal Health Caucus, and are on our heels, and I'm so excited about what they're going to do, because then we can go back to our colleagues and say, hey, we're not done yet. Although we've made doula coverage available for Mass Health, I have Harvard Pilgrim. I don't have that same access, and so 40% about the women and birthing people in the Commonwealth have private insurance, and we've got to tackle that next so that every person that's given birth has that same access, because I don't have the $10,000 to be able to hire and be benefited from that experience when I get to that point. And the last I would say is that we have been able to invest lots of money. So the House and the Senate have put toward $1 million to support birth center growth and community-based organizations. Last year in the budget, we did $220,000 for maternal mental health. It is not enough. And Massachusetts has a problem when we do something good for 1 or 2 or 3 years, we think we're done. We've solved the problem. And so we're going to need public pressure to be like, no, you're not only going to keep giving, but you need to give more. And women are very powerful. And if we all join in a unified message from Pittsfield to P-Town, I know it's going to happen. So those are some examples of the things that we're going to be working on over the next year.
Helpful. Thank you so much.
I also like to echo what Senator Miranda was saying. I think, as from the perspective of a birth center developer, some of the most important things to really create sustainability have around funding. The funding to keep the doors open will really have the domino effect into affecting the whole aspect of a birth center, whether that has to do with paying the providers appropriately, pay parity, and making sure that that continues to be supported. Reimbursement rates need to be with the bill, those things were addressed, but also making sure that they're enforced correctly. Private payers having to reimburse is also really important. Having the doors open for long term will help to decrease the incidence of burnout for the providers that are being paid appropriately. Having the doors open long term will also increase access for other people who aspire to become midwives and create a place for education, for people to be able to find places within their own community, which is really important as well, to be able to stay home and to do the training that's needed and continue to pour back into where you started is something that's really essential. So I would have to agree. I think the biggest thing that I could hope for would be increased funding and increased support that will help to maintain sustainability for the work center that's opening.
I agree with everything that was shared previously, and I am sponsoring the bill to make sure that private insurers pay for midwives, so we're working on it. To shift gears just a little bit, thinking about what we can do individually, Senator Miranda and I have the Black constituents of the Commonwealth, and I think maybe a quarter to an eighth of this month is ours. So often when we're in those halls, our white counterparts don't see their Black constituents. And I know that in every single district across this Commonwealth, there is at least one Black person, if not more. And so what I would encourage all of you to do is to make sure that you know and have reached out to your state rep and your state senator. Because Liz and I can bang down the doors till the cows come home. There are a total of 5 Black women out of 200 in the entire state house. It is not enough. And we cannot do it alone. And often what I would hear from my white counterparts, oh, that's a Black issue. Oh, that doesn't affect me. You have Black people in your district. It actually does impact and affect you. So I would just encourage y'all, it doesn't have to be advice. You're just like, hey, I'm here. These are the things I care about to your actual local state rep and state senator, so that way they know that they're accountable to you as a constituent in their district.
Please, a round of applause for our amazing panelists.
Board members, Joyce?
All the board members can come to the stage for a photo.
Oh, purple. Purple's the color today. Oh, one more? Oh.
Vice President of Engagement and Mobilization for the Partnership Week. And by night, I am a podcaster with Politics and Prosecco, where I deliver sass and tell truth to power while drinking. So follow me on Instagram.
We do.
So as we transition, do you want to take a photo? Yeah. Okay, all right. We just have to Boston, who's a founding member of MAWOCC. And Sue Coughlin-Millman, who is school committee member in Worcester. So next we will we'll move on to a panel on broader public health equity, which will discuss the current state of health inequities, including the challenges and community-driven solutions and ways policymakers and organizations can collaborate to build equitable outcomes. So please, let's start welcoming our panelists and moderators, Dr. Viviana Abreu, I want to say this right. Abreu. Did I get it? Okay, all right, thank you. President of Massachusetts Budget and Policy Center, who will be moderating our State Senator Robyn Kennedy, representing Worcester's First District. And Sharon Scott-Chandler, Esquire, President and CEO of Action for Boston Community Development.
Coffee break.
And now we have Sharon Scott-Chandler, President and CEO of Action for Boston Community Development. So this discussion will highlight MAWOCC's mission to address inequities and amplify women of color, and public health issues.
Good morning, everybody. Buen día.
Good morning.
It's good to see
Buen día.
all of you. Yeah. I was just thinking, I have spent 3 days of my week with Senator Miranda, Senator Kennedy, and Sue Millman. We have been 3 days in a row. So it is really good to share the stage with people that care. And that care about what is happening in the country and how this is impacting Massachusetts. So I work for the Massachusetts Budget and Policy Center, and I'm just going to give you the landscape of what is going on in the country in terms of budgets. We strongly believe that budgets are moral documents. So where the state allocates its resources, that tells us what the state values. So with that in mind, I'm going to give you some data. So the Massachusetts budget is $61 billion. Of the $61 billion, $16.9 billion come from the federal government. Okay? So that's close to 25%. If you're taking notes, let me know, I can repeat that because it's scary as frick. So, we have a state, Massachusetts is one of the wealthiest states in the nation. And the other day, one of my colleagues said that if you look at the GDP of Massachusetts in terms of income per capita, Massachusetts is the sixth richest country in the world. Okay? So there is a lot of money in this state. Having said that, Massachusetts has one of the more
underscored and prevalent inequities within its population. So what that means is that the gaps in healthcare outcomes, education attainment, home ownership, home income, the disparities between white families and families of colors is extraordinary. So that is the reality of Massachusetts. It's a really rich state. 25% of the budget comes from the federal government, and we have a federal government that has put forward an agenda that if we are saying that budgets are moral documents, the federal government has explicitly told us what are their values and the moral compass. So the current administration, it is the opposite of Robin Hood. Robin Hood used to take from the rich to give to the poor. It's different. It's taking from the poor to give to the rich. So for the federal government, they are extending trillions of dollars in federal cuts in both corporate tax and income tax to the richest populations in the country. And to be able to do that, they still have to balance the budget. So to be able for those multi-billionaires to not pay their fair share of taxes, they are cutting in social programs that have supported our most vulnerable populations and communities to make ends meet. So, are you following me? Is this clear? Okay, cool. So, just giving you an idea. About 1 in 6 residents in Massachusetts use SNAP benefits. So, Massachusetts population, that means 1.11 million residents are at risk of losing SNAP benefits. 1.63 million are at risk of losing their Medicaid benefits. By 2034, 201,000 people are going to lose Affordable Care Act insurance in Massachusetts in the next 9 years. So, 104,000 are at risk of losing their food assistance in SNAP. So remember that SNAP is food assistance. It should not be the primary source for people to be fed. But that's not the case. A lot of our populations in Massachusetts use SNAP as their only source of food because their income goes to pay the rent that we know is becoming unaffordable. So affordable rent is no more than 30% of your salary going into your mortgage or your rent. That's not the case in Massachusetts anymore. Some people pay over 50 and 60% of their income in housing. So think about it. So the $16.1 billion that come from the federal government, the cuts in SNAP, the cuts in Medicare, in Medicaid, the cuts in Head Start, which is access to the low-income kids of color to preschool. Add that to something we just learned last week. The Office of Administration and Finance did an analysis that the budget, that the tax cuts that the federal government is giving to the ultra billionaires It's having a trickle effect in Massachusetts because some of those provisions also come into Massachusetts. In 2026, Massachusetts is going to lose in income tax $664 million. So if the budget is 61 billion, between the 664 million loss in revenue, and if people are going to leave the state and they are not going to pay taxes, and the money that is not going to come from SNAP, we're talking about billions of dollars that Massachusetts is going to lose out of the regular budget. Okay, so this conversation is about what's going to happen to our most vulnerable populations. And when I talk about the layers of discrimination, so if you are a woman, if you're a woman of color, if you're a woman that is an immigrant of color, and if you're not an English language speaker or English is not your first language, and if you have a refugee status or you are unauthorized to be in the country, and you are a single mother and you are low income, that's who this government is going to hurt the most. So if budgets are moral documents, that's clear, isn't it? So, I'm sorry. I'm sorry because you're going to have to help us to figure this out. I just provided the data. So I'm going to start with Senator Henning. So you and I know have the same information. So let's think about what we can do. What can Massachusetts do? What can we do as coalition of women that are going to protect our best interest?
Sure. Thank you, Viviana. I appreciate setting the stage. And I think so much of what is so important right now is that this information that you shared is shared widely, that we are talking about this, that we are talking about the numbers. And I want to start by just really honoring the previous panel and all that we shared in that discussion, and really uplifting and amplifying so much of the words that were said up on the stage in the previous. And I want to specifically highlight and amplify something that my colleagues, Senator Brandy, Fluker-Reid, and Senator Miranda said, which is so important. You know, I think we talk about Massachusetts as this really liberal, progressive state. I think one of the harms that has happened over the last several years is that we've become very comfortable in our language around equity, our language around what we say when we talk about we believe in these values of DEI. What that means is I know I get, as a white woman, applause and credit when I walk into a space and say the right things. When I know the right buzzwords to be able to say. We have, and as again, amplifying the words of my colleagues, we are so far in Massachusetts from putting those words into action. And so number one, we have to hold us accountable. We have to hold our white colleagues and myself accountable that words don't matter when there's not action that follows. Words are incredibly important. We say the right things, but that doesn't matter if I can sit here and say the right things and not follow it with the right things. And that's so important. We see those examples again. It was mentioned previously. The governor often touts the fact that Massachusetts is the best place to give birth, to be a woman that's pregnant to give birth. That does not account for the disparities in maternal morbidity rates. That does not account to everything that we just spoke to. And we're not getting into the weeds as we have to be able to address that. And I want to build upon what Viviana was talking about, because when you peel down into what these cuts are looking like from the federal government, our senses have to be heightened tenfold where we even work to be able to address what's coming. Because make no mistake, these cuts and the way they've laid them out are very specifically targeting certain individuals. I keep saying all the time as a legislator, I wish if they were to make these cuts that they were just going to slash $100 million from SNAP, from Medicaid, because then we could come in and say, here's $100 million. But they're not doing that. They are strategically, by rolling back eligibility standards, targeting specific things. Let me give you a couple of examples of that. Number one, when you look at SNAP cuts, they've already said that immigrants who currently today are legally present are no longer eligible for SNAP benefits. Number two, one of the most nuanced ways in which they're going to be cutting, or one of the most impactful ways that they're going to be cutting SNAP funds is by addressing something called the error rate. And this is incredibly bureaucratic, but every state has an error rate when it comes to processing SNAP benefits. It is not anything that's malicious or fraud or anything like that. It just means that when information is taken from a consumer and processed, it's often inaccurate. Someone misses the number in their Social Security. There's a delay in reporting income changes. So there's an error rate that comes from that. It usually gets resolved. That person is eligible for benefits anyways, gets resolved. And historically, the federal government has just said, fix it, get better, keep working on how you're addressing that. Again, strategically, how are you increasing your staff at DTA, et cetera, so that you can address some of the challenges and the delays, things like that. Massachusetts right now has, post-pandemic, has about a 14% error rate. What the federal government now is saying is every state has to be below a 6% error rate, or you are going to help withhold SNAP benefits. This could cost the state up to $400 million because of that difference in the error rate that we have. Now, when you look down into the numbers, where do a lot of those error rates come from? Those who speak the first language is not English, immigrants who may not have all the information at hand when they're applying for benefits. So again, it's a very strategically targeted approach. So we have to be standing up and saying, we're not just fighting for SNAP, but we are making sure that when Massachusetts, because I will say when it comes to taking on what's happening at the federal level, it relates to dollars, and we can reserve where we should be stepping up more to challenge efforts around ICE and things like that. But when it comes to the dollars, we have said we are going to do all we can to address the cuts that are coming from the federal government. But we can't let it slip and let it slide that we're not going to focus on where these strategic cuts are going to be most impacted. There's things like there's legislation that would allow for Massachusetts to provide benefits specifically for our immigrant neighbors, to make sure that they do continue to have access. So while the federal government continues to use them as pawns in their horrific behavior, that we in Massachusetts say, these benefits are going to remain statutorily available. So, again, going back of, we have to be thoughtful and we have to be holding leaders, particularly white leaders, accountable in that it's not just the words, it's not just saying that there's health inequities, it's actually putting the action behind to make sure that we are, when push comes to shove, because we are going to have a whole lot of very difficult decisions ahead of us, that we are saying, these are our values. We are going to make sure that we are addressing that those who are most impacted, we're going to be solving for.
Accountability is just, these are important actions that we have to start strategizing in how it is that we are going to hold our elected officials accountable. Sharon, so you work with communities in the Boston area, and these have been particularly affected because in addition to the existing inequalities and disparities, the ICE raids are terrorizing the communities that you work with. So in this landscape of concerns and vulnerability, not even people that are legally in the United States and American citizens that fit a physical demographic profile. So how are you working with the communities, understanding the situation that the country is going through, and the targets is not only physical, but also emotional and financial?
Yeah, let me just kind of set a little bit of the context, so for those of you who don't know, ABCD, our mission is to build pathways out of poverty in partnership with families and communities so that everyone can thrive. We do through programs that both aim or address emergency and sort of basic crisis needs, but also promote longer-term economic mobility. And what we've seen and experienced is beyond or even more than the cuts we're talking about, because the challenges that we have as an economy that over the last, before he came into office, already basic needs were increasing. Already food security programs have increased demand. Already, the cost of living and surviving has become almost unbearable. But also, getting out of poverty and economic mobility is different today than it was when ABCD started this fight back in the 60s. You can't rent an apartment or buy a home. It's $3,000 to rent a 1 to 2 bedroom. Buying a home is, now we can buy homes in Syria in some places. We couldn't legally back in the 60s, but now we can't even afford to buy homes. College education used to be the way out of poverty. You get crushing debt, and now we're talking about limits to that college education. So it's really overwhelming for our communities as to how they're really going to move and achieve and economically kind of be self-sufficient, if you will. But I will say that we've been here before, and when I look at Senator Wilkerson, I say to myself, we have been through these many challenges before, and we know how to strategize, we know how to fight, we know how to do what we need to do to not let progress stop. And so I think that's what we communicate and we talk about with our families. We make sure that the programming that we have can be responsive. We make sure that we're looking at the policies and the regulations and the eligibilities and trying to make people aware of the changes, help them navigate that. And so it's a challenging time, but we are determined to work with other organizations, work with our leaders to make sure we can navigate these times and get through.
So I have a question and this is for my own understanding as an elected official and as a community that from organizing activism and advocacy. So when and until, so how do we marry navigating the circumstances and resisting what's happening? So resistance is important. Being loud about the narrative and the counter-narrative that we have to do. When does one stop and the other starts, or do we do it at the same time?
I think from where we sit, it's doing it all at the same time, but everybody may have a different role in this fight. Some people are going to be providing services, some people are going to be advocating, some people are going to be agitating, some people are going to be suing in court, some people are going to be voting, some people are going to be running for office. And I think there's so many roles that we have to play, and there's not one box and one way to do it, and we all have to come together, recognizing that we have those strategic things we have to think about how we do it.
So for be a multi-approach, and we need to ask ourselves, what is my role in this equation? So, and you can be multiple, and
right?
you can be multiple. You can show up to the protest, and you can also advocate and pull your elected officials. So, from the elected official perspective, the progressive approach to understanding politics, budgeting, advocacy, and you are, when I think about my progressive legislators, you and a handful of others, because some self-identify as progressive, but they are more moderate. And these are bold times. How do you, or what kind of support do you need from us to help with the counter-narrative? How do we support you to help us?
I do agree with Senator Miranda said it, quoting Congresswoman Presley, that the answers lie in this room. My job is not to tell you what I need from you. The answers lie in the room. My responsibility is to be bringing those answers forward. And I think that, I hear Representative Fluker-Reid, and I hear the exhaustion. I see it in the women in my community, the women of color, and I hear that, and I see that, and I think that, and I want to know that we perpetuate that exhaustion. I so deeply recognize the role that we play, even in, as she acknowledged, even in best intentions often perpetuate that pain, right? And so I think that there are so many things that we need to be doing differently. First and foremost, I fully recognize the safety that I have in this moment, right? The safety of my skin color, the safety of my financial standing, the safety of that I could walk into a room that looked very different and carry the same unquestionable respect by my title that others wouldn't have that privilege of. And so I fully recognize that bears a different responsibility on me in terms of what it means to be bold in this moment, what it means to be willing to put that skin on the line and stand in these moments and in spaces where it's truly not safe, including in the halls of the State House with vast majority of legislators look like me. And where in those spaces I have a greater responsibility for pushing and challenging. And that's really important. And so much it's important to me to be able to say, because I think, also when we look at, the budget as a whole, we talk about it as a value statement. There's this often other layer of discrimination that comes into play that says, when you talk about organizations led by communities of color, there's a greater scrutiny, right? Will they use it right? Is it a good return on investment, right? The same, even from a nonprofit status, the same type of scrutiny that doesn't exist in white-led organizations. And that's historic, that's systemic. And so part of my role in that is to be able to trust, to know that the work is happening, to know that part of what we need to be doing, part of the reparations that we owe, is giving those dollars back to the community. And so that is what moment. And a call to action in this. Right now, the governor is sitting on legislative earmarks. MAWOCC has an earmark that's pending in that. The Worcester Borough Center has an earmark that's pending in that, that's being held up. ABCD has an earmark in that that's being held up, right? Call the governor, right? This is equity. This is equity. It is not about a gazebo and a lawn somewhere in some town that maybe can wait a few years, right? This is equity. This money has to get out the door. And so our role in this, my colleagues in the legislature, is to bring that money forward. Right now, we need the governor to put that money out into our community so that this work can continue, so that when everything does continue to fall, we are investing in our community to be able to stand and support, because so much of when the cuts are coming from the federal government, It is these very resources, like MAWOCC, like the birthing centers we're talking about, that are going to be there to protect our community. Not the elected officials, right? We're still going to be working in Boston, it's going to be in our communities, but it's going to be these community organizations that are then doing the actual work to support those that are most impacted. And so we really need to make sure that we're continuing to do that, get that investment out into the communities.
Of course, in this room, this will resonate, right? Which is policies made and developed that have women's barriers, challenges, and needs in mind. Because we know that, whether it's womb to grave, that women bear a lot, and especially in our communities, the well-being of the family unit on their shoulders. And so whether that's programs and services like we run, that focus on childcare and being able to work and focus on living wage and getting into industries that pay more money, whether that's just, the Special Commission on Poverty and several recommendations around cash assistance, reforming child support laws, income tax credits. So there's all of these policies, services, programs that focus on addressing the challenges that everyone has, but really sit at the intersection of women's needs.
So I'm going to open for questions from the audience very shortly. So just to plug in the organization that I work for. So we do all of this research and analysis of policy from the progressive perspective. That's the Massachusetts Budget and Policy Center. So educate yourselves. Read, learn the numbers, because when we go to the legislature, and we do that on a regular basis, I meet with Senator Kennedy and Senator Miranda, you need to be armed with data. Data is very important. It is as important as lived experience and testimonies. But, when we have lived experience and testimonies and we go to the legislature, our white counterparts tend to think that this is a very individual request and not community based. Bring your data. Talk about numbers. Let them know what a specific budget ask means for your community. That's the way that we can get things done. So I am opening for questions from the audience. Yes? I'm going to go down and I'm going to just wait for me. Yes. I'm going to do this. I can do it.
Hi, good morning. My name is Louise Freeman from Worcester, Mass. I work in Massability and also the chapter president of 7519 Massability. First of all, thank you ladies very much for your information. And what would help me is help my members and also the people who I work with, which is the most low population. I'm the only rehab counselor for the deaf and hard of hearing that is a person of color that signs in the state of Massachusetts. And I've been there 26 years. It's very isolating and it's very sad. And so we are, the federal government being shut down, it's affecting the people we serve. And so what would help me to help my people is if you have like a one-pager that's easy, like C-SPOT or language, like break it down to them, that I can share with them, that they can understand. And as soon as you get that to me, I can get it out to the people that I work with and also the members. So I really appreciate that.
Yeah, you work for my unions. SEIU is fantastic. I work with 1199. Other questions? Yes?
Good morning. I'm Diane Wilkerson from Boston. I actually, so much. Here's my question. I think you said, Senator Kennedy, 61 billion of our budget. We have a $61 billion budget, 16 billion from the feds.
20 billion from the feds.
29?
19.6.
Round it off. Yeah. Round it off.
I round up.
$billion is, this state. And I think there may have been some kind of reference to this, but the question I think and the challenge that I would like you to address head on is I just think we need to know how to challenge our friends. I don't understand the governor's budget at all. I can't understand why we would be thinking about spending $400 million for a new women's prison when we have like 150 women total in the system right now. This is insane. But is it that, people want to be friends with her, want to be nice with her? I'm her friend, but I challenge my friends. And I think that the lesson from the last election is that you can't call yourself a progressive and representing me if you never talk to me. I think right now the progressives are the biggest obstruction to real equity for Black people. Because I don't know who they're representing. They don't talk to us. And if the point was to be our supporters, they're in another place right now. We have so many progressive organizations in Boston. I have really? Really? You can't be representing us if you don't talk to us. And I just think I'm not even talking about Democrats, I'm talking about people who believe in social equity and justice. We got to deal with that. Because I think that's why things are so confused and messed up right now. Like, MAWOCC, to me, is the perfect example. It doesn't get credit for the whole mission. I have the privilege of having been one of the founders. We sat in a room and struggled about how to make sure that we weren't just about Black women. You see this room? There's no other organization of people of color who sit in the room saying, let's start an organization and include Black women. We always do that. And that's the kind of conversation to me that we need to be having. And I thank Cynthia because
She's over there.
She's been on this mission for 10 years. But we gotta have some real serious conversations, ladies. Because, this progressive stuff ain't working. That's all.
Agreed. I think that there's a few directions I would go, and I would say, certainly the challenge needs to happen, and echo that the challenge needs to happen collectively. I think one of the most powerful data is incredibly powerful. Stories of what this means in real life, in real terms, in changing hearts, not just minds. The data really gets to the minds, but changing hearts is so incredibly important because so many of my colleagues in the legislature don't have that lived experience and haven't been willing to engage in those conversations, so forcing those conversations. The other thing that I'd say, as an elected official, and something that I'm very conscious of and would challenge my white counterparts to recognize, which is also a very real conversation we have to have. These should not be lifetime careers in elected office. These should not be lifetime careers. It is without question that it takes some time to be able to move an agenda when you're in elected office. 10, 12 years, maybe, right? And there is incredible power of incumbency, although shout out to Congresswoman Presley for changing the game. But there is real power in incumbency, right? And so we have to recognize that we have an incredibly brilliant talent pool here in Massachusetts. And I hate to lose my colleagues in the legislature, we have an incredible talent pool that is very ready to take the reins in Congress, right? That is incredibly ready to take the reins in the U.S. Senate. And in doing so, and making those shifts and making those spaces, that opens up opportunities for other folks in the community, city councilors, school committee members, those that never even thought about running before, to step up and run. But when we hold those seats until the day we die, we hold out in about my retirement. I want to challenge that we have to be willing to acknowledge that and acknowledge the role we play in that, because Dr. Johnson-Agbakwu said correct. Representation doesn't just matter, it is everything. And it does not exist here in Massachusetts.
So that's your recommendation. Run for office. What would be your recommendation to this group? How are we going to navigate the next 3 years?
Well, I think we're going to have to think a little bit outside the box of how we normally think.
Yep.
To the senator's point, and I would say, on the left or the right or in the middle or wherever. And one of those is, as organizations like mine, working collaboratively with other organizations. I mean, we've gotten into this sort of a space where we're just focused on what we need. We're just focused on what we do. And we're going to have to work collaboratively. There's already been efforts. United Way has some things going. Urban League has been pulling Black leaders together. So we really have to think creatively, innovatively, strategically of how we're going to navigate. And I don't just say survive, because, again, we've made a lot of progress from where we've been. So we know we will continue to move forward. But we have to keep that fight at the same time working together, no matter where we sit, as the progressives, as the right, as the left, and try to really move forward together.
I just want to make one amendment on to my point about definitely run. Please run. Please call us for help when we want to run, because we also know that even understanding candidates of how to run is one of the biggest barriers. I also want to put in a plug. When people of color do run, show up for them too. And right now in Worcester, on our city council and our school committee, we can fundamentally change the face of both bodies. But it is the candidates of color that are facing, for a multitude of different reasons, the biggest hurdles, including from other communities of color. Right? We're going to acknowledge that. I'm not validating, supporting anyone that's inherently problematic and has to do their own work first, right? But we also have to be showing up and having those tough conversations. And I recognize in mind I'm not meaning to lecture, but I also want to acknowledge that when people do run, there's an obligation on myself and everyone in this room to show up and help them get there, because we often see it is the candidates of color that then are least likely to be able to make it to the next step to get elected.
That's true.
Another thing, and I think it's been referenced, is really, because that's how we do it at ABCD, the community has answers. Do not underestimate us in the community. And ABCD, where probably we serve 60% women, probably about 75% women of color. Our staff reflects that. But even as a staff, we don't think that we know all the answers. So we look to the community, we try to organize the community and understand what those needs are and be responsive. And to the senator's point, elected officials, policymakers, all of us around the table need to understand the community's role in getting through this.
So this has been amazing. I will only another. I can ask another question. Thank you so much. Okay. So I was going to close, but she's giving me the chance. Thank you, Sylvia. So for closing, I think that I start by showing up.
Right.
Yeah.
I have a quick.
Okay.
Another question.
Yeah.
Hi, my name is Rivera-Cotto. I learned a lot from you all, and thank you for all the panelists and all the things that I learned. But I think I'm just thinking, when we have people gathering like that, we need to invite people like the governor. We need to invite all the white legislators so they could hear. We talk, like we say, we're speaking to the choir. We need to have the pastors, the bishops, let them hear. Because a lot of times they don't understand what we're going
showing up. And this is why I started by saying, I've been 3 days in a row with Senator Kennedy and Miranda. 3 days this week. And what we have been doing, yes, we should move in together in carpool. So, my last question to our panelists, and yes, and I'm actually going to piggyback on what you said. So one thing is for elected officials in government, employees that, secretaries. Let's not, appointed officials are very important too. Remember that, the state gives a budget to the Department of Health and Human Services and Transportation and Education. They distribute that funding within the department. So they are as important in terms of regulation drafting, in terms of allocating resources, in funding programs and prioritizing the needs of their community. So it's not only the elected officials. They give them the money and they decide based on their perspectives. So it is not only them showing up to events like this, and this is the politics of accountability. That's the part that we need to start strategizing. How it is that we are going to hold them accountable. But how do we show up to them? That's my question. Because I am not going to wait for them to come. Where do I go? How do I do it? And then we will close that. Senator and then Sharon. I show a video.
Showing up is our job. I don't understand. I think you hit the nail on the head, and you mentioned it earlier. It's all about accountability, right? There's nothing an elected official understands more is that every 2 years we are held, in governor's 4 years, held accountable, right, to the voters. And so they are listening. They are listening to the people that are showing up, right? And so they need to be able to be heard. I know, speaking to many of my colleagues, we have office hours. We have ways in which we are out present in the community. I think the invitations are so important. The follow-up of, we didn't see you there. Where were you? What happened? Requesting individual meetings, reaching out and saying, okay, we want to sit down as MAWOCC. We want to sit down with ABCG. We want to sit, which I know is happening. Just seeing the first organization I'm speaking to. But that bringing your organizations, and we want to talk to you about this very specific thing. And we're going to pay attention. We're going to pay attention to how we follow through. We're going to pay attention that, every legislator, although I'm not sure what next year is going to look like, but historically has always been able to bring forward the priorities of their district to request earmarks. We're going to pay attention to where you're putting your values, where you're prioritizing, where with limited ability to do that, what you're choosing to ask for earmarks for. We're going to be paying attention. And we're going to be mindful of how that shows up when you're looking for us in the next year, right? Next year's election year where we're all on the ballot again. We're going to be paying attention, and we're going to come back to you with accountability at that point.
I think it's a couple of things. One is education for us. So what can we do and how can we help this, which is educating our communities, because they're struggling. They're not watching the news every day and reading papers and having these policy discussions. They're trying to feed their families and keep a roof over their heads. So one of our roles is to help them understand what is going on, what is going to impact them, how is it going to impact them, and how can they get involved. Head Start is one of those programs since its inception. We, talk with families not about, children's development and them as their child's first teacher, but also what their role in their child's future is and how they can influence it. So once a year, we bring them up to the State House to advocate. They go and visit our legislators. And let me just say, thankfully, we have the greatest legislators we can in our communities. But that's one of our roles, is to educate people and help them have voice, help them use their own voice, not just us, but their voice.
Please, this has been amazing.
Let's get the board members again for can we move down here this time? And I just want to say, remember this moment when we are on the hill as MAWOCC. When we are on the hill at the State House and we have our legislative day, that's how you hold people, legislators accountable. So make sure you show up with us when we are ready to be announced. Oh.
Ladies and gentlemen, you all can just remain seated. We have a special guest that's on the way. Yes. Hang on. In the meantime, I'm going to banter over Senator Kennedy, who I've never heard any elected official put themselves on the block to say, run for his seat. And executive director positions that are opening up across this Commonwealth. We just don't need warriors on Capitol Hill, Beacon Hill. We need them in corporate spaces where a lot of bias actually happens on the ground. So encourage somebody else to run for an executive director or encourage them to apply for a CEO position. That is really, really important.
Me first. To the right. All right. Sorry. Okay. Oh, wow. Great picture. Yes. Okay. I just want, you all look so beautiful. Thank you so much.
I used to be a busy person. dominatrixes were banned from competing because they told truth to power and they were armed at all times. And so I want to welcome our Congresswoman and warrior in the halls of Congress, Viviana.
Did we just say showing up?
Okay, I don't know how this is going to go, y'all. I'm just, first let me just say, it is good to be home.
Yes.
It is good to be in the Massachusetts 7th. It is good to be in Boston. It is good to be with my sisters. So let's just clap on that. Because the fact of the matter, listen, coming out of Washington, D.C., a place in the midst of a militarized occupation, a place that is still fighting for statehood and for its freedom. And then coming here, recognizing that despite our many progressive bona fides, that there is still much work to be done here for people to enjoy their full freedoms. And that is especially true in this moment. So there's a lot on my mind, there's a lot on my shoulders, there's a lot in my heart, but I'm going to do my best to lean on my Methodist roots and not my Baptist ones. Because I know y'all have places to go and things to do, but there's a lot that I wanted to share with you. So the first thing I have to do for housekeeping is I've been speaking a lot about the fact that people keep asking me, how do you keep your hope in a moment like this? And there are two things that guide me. One are the words of Scott King, who said, freedom is never really won. You earn it and win it in every generation. And so that calms me, because it's a reminder that the path to justice is not a linear one. It's a very jagged road, a disruptive algorithm. And so each of us just have to pick up the mantle and do what is called for us to do in this generation, because the gains that have been made do not exist in perpetuity. Some people hear that and that feels defeatist to them. It calms me. It gives me anchoring and clarity about what my call to action is in this moment. Right. Freedom is never really won. You earn it and win it in every generation. And that takes me to the fact that someone else already wrote the blueprint for my survival. And one of those people is here. And that is Senator Diane Wilkerson. So I just wanted, it's important. I won't start naming, every name, but, you have to give credit where credit is due when it comes to a blueprint. And just recognize that in this moment, we must write the blueprint for someone else's survival. And do the work of delivering a love letter to future generations. We're planting the seeds for rights and freedoms that we may not even see matured and realized in our lifetime. But we must still pick up the mantle and do that work. Okay. So now let me get into my prepared remarks. And then I have one quick thing I'll share with you. I'm trying to keep that on my phone. Okay. So good morning, family. Let me begin by thanking the Massachusetts Women of Color Coalition for bringing us together in this powerful space. For us to even come together is in and of itself a radical act. To assemble, to convene, to strategize, to mobilize is in and of itself a radical act. MAWOCC is at the heart of this work because real change isn't handed to us. Real change is organized for, it's fought for, and it is led by women of color who make it happen. Which brings me to the profound words of Anna Julia Cooper. When and where I enter, the entire human race enters with me. That is is what we do. When and where we enter, the entire human race enters with us, because we have always been the architects of change and progress. We have always been the justice seekers. We have always been the truth tellers. We have always been the table shakers. So each of you are honoring that long-standing tradition. In the midst of government shutdowns and all the uncertainty around us, it is really a true joy to be in community where our experiences are centered, where our brilliance is recognized, and our solutions are lifted up. Today, as we regroup and strategize for a Commonwealth rooted in authentic inclusion, where racism and sexism no longer dictate outcomes for women of color, we celebrate hard-won victories in maternal health. And you all know how often I say that policy is my love language. It is not just a t-shirt, though I do sell it. It is a practice, because every harm that has been done to us is the result of either policy violence or policy neglect. The harm we are experiencing and that we have experienced has been legislated, discriminate, precise, and intentional. And that means in order to undo the harm, it has to be legislated. And so I just want to give a shout out to my sisters in service on the legislative body here. I don't want to leave anybody out. Senator Miranda, thank you so much for your leadership. Representative Fluker-Reid. Okay, let me get it right now. Okay. Any other of my legislative colleagues? Oh, thank you so much. Yeah. The point is, okay, well, I'm not trying to leave anybody out. Have y'all been recognized? Everybody stand up, please. Okay, please, just let me just clap for you one more time. Yes. Please do not take their leadership for granted. Given the chaos and dysfunction of Washington, and let me just be partisan for a moment and say, because I need y'all to say, under a Republican majority.
Under a Republican majority. Yep.
Please be specific, okay? Mm-hmm. So given the chaos and dysfunction under a Republican majority,
that's right.
The work of my sister legislators is so essential because they are standing in the gap. So please do not take their leadership for granted. So this moment and this convening, this is exactly what it looks like when women of color lead. We change laws, we save lives, we make government work for the people. But passing a bill is just step one. The real work is making sure it is implemented, that it is fully resourced, and fully accountable to the communities it is meant to serve. Something I learned from my mentor many decades ago. Every law is only as good as its enforcement. That's right. And so it's so important that that oversight continue after the fact. Now, as you all know, ever since the occupant of the White House took charge, you probably use that now too. Okay. Ever since the occupant of the White House took charge, we've seen program cuts, attacks on women's health, threats to maternal care, and assaults on education, housing, and economic security. These threats are real. Our rights are under attack. But I cannot spend my days wondering how low can they go. I must instead be focused on how hard can we fight. And we must fight. Because Donald Trump is a dictator. And the only way to be a dictator is with defiance. Mm-hmm. It is not by appeasement. No. And that's why we must remain vigorous and vigilant in our defense of our communities, of our women, of our rights and our full freedoms. We have to organize together and fight like lives depend on it, because they do. And this effort here shows us what's possible when we organize, lead, and act together. We must keep maternal health and all women's health front and center in every policy, every conversation, and every decision. These are not women's issues. These are family issues. These are economic issues. These are racial justice issues. These should be of concern to any person of conscience. Similarly, as I've taken on combating the unemployment crisis for Black women, I've had to remind people Black women have always been the canary in the coal mine. So when overall unemployment is at 4.3%, and for Black women it is at 6.7%, that is devastating for Black women, Black families, and Black futures. And it is a sobering economic indicator of what is to come for everyone. So although Black women bear the brunt, this harm is coming for everyone. Again, we have long been the canaries in the coal mine. And so on all of these issues, they are intersectional and interconnected because that's actually how we live our lives. And maternal health should be a priority to any person of conscience. We have to support the people most impacted, demand equity, dignity, and justice everywhere. This is work of healing and community. This is work of justice, and we will not stop until every woman, every mother, and every family has care and dignity. And the final thing, thank you. You see, the first person to talk is my aide. Sophia MD, she's like, I did that. Listen, I was an aide 16 years, so I'm back on the front line. I did that. Please give it up to my staff. I mean, y'all know I know how to write. Mateo, also an incredible member from my team, was sharing some of what was being offered before I came in the room, and maybe it was from my dear sister here, Jacquetta, as I've just been talking about the role that everyone has to play, and I've just been appealing to people to just bring your gift to resistance. We all have one. You know, you don't have to be a congresswoman, you don't have to be a journalist, you don't have to be an activist, just bring your gift to the resistance. So I'm delivering a speech, someone else make sure the microphone works, thank you. If I'm marching, maybe someone else packed the brown bag lunch that fueled me in the march. If I'm holding a sign, somebody else made that sign. If I'm singing a freedom song, somebody else wrote it.
Yes.
Maybe somebody else. It is being a diligent prayer warrior and praying for our safekeeping and guarding. We all have a role to play, so just bring your gift to the resistance. And the final thing I would say is when they are coming for our civil rights and our civil liberties. Some people I know, because I'm Aquarius, and they think that this is a very hokey thing that I'm about to say.
Yes.
Shout out to all the Aquarians, you're the ultimate humanitarian.
Exactly. Yeah.
Even in our eccentricity.
Yeah.
But what I will say is that we cannot give them our dreams too. And all radical work begins with radical dreams. And I think a lot about Dr. King's, the March on Washington for Jobs and Freedom. He was not supposed to deliver that speech. You all have heard that story, right? Mahalia Jackson said, Martin, tell them about the dream. He could have got up there and enumerated every inequity, every disparity, every injustice. But instead, he gave voice to the vision and the dream. And I remember being actually Senator Miranda. She and I remember this was a turning point for me. We were at a fundraising effort for the birth center. And the doulas that were there said, this is my last Black Maternal Health Week. I will not participate in another one. And I asked the question, why? And they said, because it is very traumatic to travel around the state talking about all the ways in which Black women are likely to die. And so we had a conversation and said, well, what if we flipped it and gave ourselves permission to name the affirmative? Imagine being Black and birthing, knowing that you are safe, loved, and sacred, that you survive that birth and go on to raise your child. So I want to say that because as justice seekers, sometimes we sit so much in the deficit in the work of the resistance that we are not naming the affirmative. So the last thing I want to say to you all is all radical work begins with a radical dream. So please be unapologetic in that. Thank you.
into equity, inclusion, and a better outcome for the women of color in Massachusetts. A few housekeeping notes. Tonight's 10th anniversary gala will be held in the Plaza Ballroom starting at 6 p.m. Make sure you view the silent auction items by scanning our QR code on the back